As a healthcare provider with the social mission of eliminating health disparities, we saw that there would be social unrest at the heels of not providing enough access to health services, specifically COVID-19 testing. One of the main ways that we responded was by setting up outdoor evaluation testing centers. We have a partnership with the city of Los Angeles, the county of Los Angeles, where we started to see the data show us that immunizations weren't happening. So being able to put together a drive-through or outdoor immunization effort was very important. The community and the families quickly adapted to being able to bring their children and feel safe. We're doing work outside. I mean, we've never worked outside our clinic walls. In our transition during this pandemic to make sure we maintain access to our patients was we found ourselves using telephone. We've tried video, but mainly telephone because many times our patients are limited with broadband access or having the right connection, the literacy to really walk through and get the video to work. Over the phone, we have to work a little harder. So interpretation becomes even more important for our patients, so they understand what we're recommending and they can ask us questions and we can answer them. And so we went probably from close to 0% of our encounters with patients being telephone or video to close to 60% today. And we've maintained that. We've had great reception. We found ourselves in a situation where we're so used to doing work together and in person that we didn't have that as an option. And so we went from what I would say 0% tele or WebEx meetings to all our meetings being mainly WebEx. And that's been a huge cultural transformation for us because we've had to not only learn how to use the technology, but still be effective in getting our communication across, but also that we have an opportunity to engage on a more consistent basis with each other because we've saved time on having to travel. So we hope these technologies evolve and help us continue to make sure that social connection is there. I do think the pandemic has highlighted some of the inadequacies of our healthcare system, and more importantly, how we think about our healthcare workforce and those on the front line. We are essential, but we can't be, the canaries in the coal mine where we are exposed to all the hazards, and not just COVID. I mean, all the anguish that our patients are facing as providers here at Ultimate. We had already begun to work on how we work to partner with the California Medical Association across the state to really address burnout. Being able to have those conversations with our leadership and allowing them to be able to have a safe space where people can bring these issues up, making sure there is true wellness amongst our healthcare providers. I do believe that our responsibility as leaders is to make sure that we balance what we're asking of our healthcare workforce and also acknowledge all the great work and not forget how far we've come despite the new challenges we're going to face moving forward.